which you may feel you're not equipped to answer, so please say so. But I feel since you come straight after the last witness and you were here hearing what he had to say, how do you say we as a board, if we can be regarded as that, but anyway, as an inquiry, should be marrying the standards which have now been set, apparently for the first time, which involve on-site consultants and radiology, possibly to the extent of intervention, which means the only way they can provide it is reduced sites. How do we marry that with your needs? And I think if you follow the question anyway, do you have some observations about this?
I sympathise with the arguments he was putting forward about the need to concentrate skills and specialisms. But it is not as if there is no alternative. We should be able to provide those skills and those specialisms in all A&E units, the ones, including the ones that were closed. I don't think closing those has made the situation any better. Of course, this involves greater resources to be put in the NHS. I think this is an argument you'll speak. Why does the NHS have to suffer these cuts? This is central to all our lives and our families here. There should be more resources put in the NHS, and the A&Es should be reinstated. We should have local A&Es, because in the scenario that the previous witness was putting forward, the stress on the capacity and access to the new remaining A&Es, it doesn't seem to me to have been studied very thoroughly. Anybody who's gone to St Mary's Paddington will be aware of the difficulty of getting to it. Now, where there's urgency, where somebody is dying, where there are broken limbs, then it should be much better to have closer local A&E hospitals, rather A&E units, rather than one which is going to be overcrowded and where the traffic is going to be enormous.
Yes,
I hope that answers your point. I'm really saying there should be increased resources.
yes, which was my supplementary question to him. But his answer was it's not sensible. Does it appear to be that it's not sensible for clinical reasons or not sensible for economic reasons?
I think it was for economic reasons. That's what I had understood. The prevailing policy of cutting services, of reducing expenditure. This is the framework in which that sort of argument is put forward. I don't accept that argument or that framework.
Yes, thank you. Questions? No? No? Well, thank you very much indeed.
Thank you.